This podcast is brought to you by the Maryland State Library Agency. The MSLA podcast features presenters from statewide youth programs, as well as learning opportunities for library staff and resources for patrons of the Maryland State Library for the Blind and Print Disabled.
Welcome, everyone. It's Ashley with the Library for the Blind and Print Disabled. I'm so excited to have you back with us for another LBPD guest hour. Today, my guest is Tiffany. Tiffany is a skilled cultural broker and the founder of Rose Petals Consulting, specializing in fostering collaboration and equitable outcomes. With expertise in race, class, and restorative practices, she connects data with human stories to drive systemic change. Tiffany's lived experience and dynamic facilitation help communities identify barriers and co-create solutions. She serves as co-chair of the Montgomery County Anti-Hate Task Force, was the vice chair of the Gaithersburg Community Advisory, on the Gaithersburg Community Advisory, and is a member of the Racial Equity Network. And I had the most amazing time finding Tiffany, let me tell you. So we connected and we spent what was supposed to be a 10-minute just hello conversation turned into like 40 minutes of just us chatting like two girlfriends over a cup of coffee while she sat in her car on what was a very windy day, I'm sure. And I'm just so happy that you agreed to do this. Thank you so much for being here.
Ashley, I have to say thank you for having me. This is a subject that we never really get to talk about at length outside of data points, especially with the intersectionality of so many different factors, including people who are dealing with being blind or having an issue with their sight. So I'm really excited to be here today. Thank you.
I'm going to jump in with the first question. Tiffany, you deal with a lot of data points and you give a lot of inspirational talks about class, restorative practices, and intersectionalities of all of that. And what are some of the main contributing generational poverty factors in Maryland, specifically in urban versus rural areas?
Well, interestingly enough, I was born in rural America. So I have a perspective there that generally doesn't exist. And I've been able to identify some of those barriers based on my own existence and my own challenges. One thing we look at when we talk about economic struggle to include poverty, we don't look at what the system side is doing to exacerbate economic struggle. There's a weight and an onus put on people who are experiencing struggle, and they oftentimes have less than anyone else, but they're expected to do more. People are not served in a way that's humanized. It's a transactional type of relationship. And as a result, we continue to fall short in addressing not just the number that's associated with earnings of people who are in struggle, but what that does to their existence. And if we don't look at what poverty is doing, what economic struggle is doing, we are going to fall short every single time. I like the fact that you mentioned generational poverty because generational poverty is very different from situational poverty. Sometimes when a woman is married or a man is married and their spouse passes away or loses their job, becomes ill, they may experience situational poverty. And what that sometimes means is that because they come from the middle class, they can navigate out of that situation far easier than those who have grown up in their mother, their grandmother, their grandfather, and all of their family have been poor. They typically don't have the same understanding of systems. So they continue to live in the existence that generationally they have dealt with. And a great example is me. I just entered the middle class about 4 or 5 years ago. My son is a phenomenal artist. And I just happened to find a gentleman who was an artist that wanted to take him on as a mentor. And the things he was saying to me about what my son should be looking at right now had escaped me as a person who doesn't come from that world. I come from a world of economic struggle. So while on paper, I have the money that takes me out of poverty, I still don't possess the systems knowledge to help my children not relive the same existence. So I will go back to your question, urban versus rural. Urban areas typically don't lack the systems, they don't lack the resources, they don't lack the transportation. But what they do have are high concentrations of poverty in many different areas. However, if you need public transit to get to the service, it exists. In the rural community, however, there are not the same economic opportunities. Jobs just don't exist outside of the serving sector, outside of being a cashier. Um, Oftentimes, public transit is not existent. It's very few bus lines, if they have buses at all. One thing we've tried to do in rural America, especially at the federal level, is policy solutions. Unfortunately, rural America continues to be underserved, and it's no different in Maryland. And the outcomes are just not the same because of the lack of the proper investment. So if you're born in a rural area, you will continue to struggle in ways that people who don't have that specialized knowledge and understanding, they cannot policy those struggles out. So we have to begin to look at rural America challenges far differently. You can't just say we're going to spend this money. You really do need to get at the ground level to understand what those challenges are to craft the best solution. Urban areas, it's a bit different. They are dealing with, like I said, the low wage sector, but they do have resources that rural America just does not have.
Wow. It's funny because when I think of, all the programs and things like that, you're right. There's so many, I hear about them being part of, I guess, bigger cities. Um, and uh, I hear about the investments in the rural areas, but I don't really think about, bus lines. I don't think about public transportation in the rural areas. I just don't. I think of that as a city thing.
Right.
So that's wow. But that does lead me into my next question. Generational poverty leads to systemic poverty. Systemic poverty in Maryland is a thing. And how does systemic poverty in Maryland affect access to education and employment opportunities? Because something that you said really kind of connects that, doesn't it?
Abs- Absolutely. Again, I look at things from a lens of a person who is a descendant of those systems that came from generational poverty. My family, for the great, for the most part, they were agricultural workers, which means that they pick the food that feeds the country, right? So they would travel on the season and they would work in the fields. My family did not have an understanding on how to navigate systems of education. You just go to school because they didn't get to. So their only perspective was either you went to school or didn't, and you graduated or you didn't. I live in Montgomery County, Maryland, arguably one of the wealthiest counties in Maryland. So I'm going to use their data because I have that readily available. It's really easy to focus on race equity. And oftentimes when people hear equity, they hear race. When I hear equity, I hear ability versus disability. I hear age. I hear gender. And I hear economics. One thing we know here in Montgomery County Public Schools, the students with the absolute worst outcomes are free and reduced meal students. In fact, when it comes to discipline, 73% of school suspensions are free and reduced meal students. There's something wrong with that picture, and we know that something is happening. It's not enough to report on the number. We have to do some type of qualitative analysis to figure out why that's happening. I was a student who tested as gifted because one of my teachers decided to see me. And even with testing for gifted, I barely graduated from high school. I stayed in low wage work for most of my life. And again, I received my last public benefit about 4 or 5 years ago. Something happened to me K through 12 that did not help me to escape generational poverty. We have a lot of reactionary types of measures. We have rental assistance after the fact. We have eviction assistance after the fact. And those are limited funds. Those are programs with limits on what they can do. When we talk about hoping that people decide to change their lives as adults, we are really perpetuating a very limited amount of help. But one thing I know for sure is just about 100% of students go to public schools. Inequity doesn't start at 30. It starts the day people are born. It starts in pre-K. When we think about who's suspended at 4 years old from pre-K, it's Black boys. When we talk about K through 12, we have an opportunity that we haven't realized. And I believe a lot of that is because we have an antiquated model and understanding, again, of economic struggle and what it does. What I can say it did for me is that it did not allow me to access all of the resources that were available because messaging and those programs weren't crafted to a person whose family's history did not include the phenomenal programs that exist. The county that I live in has absolutely wonderful programs that literally a student could graduate and start making a living wage tomorrow without a college degree. However, when I speak to students who are free and reduced meal students, when I speak to students who are Black and Brown and part of other marginalized groups, they don't even know the programs exist. The programs truly are not marketed to them. And I've expanded my understanding on the community of people who are blind or deaf. And I'm finding out that those populations are so underserved, they tend to drop out of high school. When I think about leadership in my community, I can't think of one person who is deaf, hard of hearing, or blind. That's an indicator that there are still gains to be made in so many different areas. But it starts at the education system. There's an accountability there and a potential there that just hasn't been realized. And we really do need to start talking about that more outside of just the number. It's not enough to say this is happening, but it's how do we shift it, especially in this particular era that we live in. This is not 1985. Why are we still serving like it is? We have an opportunity here that we have not realized.
It's not 1985. Why are we acting like it still is?
Everything moves at the speed of light except how we help people.
Well, and that kind of brings me. You said something that was really really profound, and I just want to hammer on it for a second. I'll use a rubber mallet so that it's a soft hammer.
Okay, thank you.
You said that there was housing assistance after the fact. What ways do housing policies in Maryland contribute or alleviate poverty in Maryland? Or do they not?
Oh boy.
I mean, because you said that Montgomery County is one of the wealthiest counties, and I live in Anne Arundel, which is also a wealthy county. I work in Baltimore City. So what ways are housing policies doing their job, and what ways are they not, do you think?
Well, one thing I was proud to be a part of here in Montgomery County was the fight for rent stabilization. That's not rent control. Rent stabilization means that landlords can ask for an increase that's reasonable. Too many people are facing increases 10%, 15%, and wages just don't go up that rapidly. Governments can really protect their tenants, but many of them are developer friendly. It's rather smart because we do need the tax base. We need the people here, but not at the cost of losing our teachers because the rent is too high, not at the cost of losing a cashier because the rent is too high, not at the cost of you losing our daycare workers because rent is too high. There really does need to be a balance. I applaud Montgomery County for passing that legislation, but there are two jurisdictions within Montgomery County, Rockville and Gaithersburg, that refuse to even discuss rent stabilization tactics. So what's happening is that we're losing a workforce that we need. Our teachers can't afford to live here. That impacts the educational experience of children. That impacts the educational system, and that impacts society. We have to tie these things together. By working on making sure that our cities are affordable, we retain the talent we need. We retain people from birth until the end of life. That translates into a stable community. One thing that we need to do is make sure that the renter conditions are appropriate. Again, if you have a child who's living in a place where the conditions are bad, how will they show up and learn properly? We need to recognize just by saying we have affordable housing and not attaching a number to that based on our area's income, we're just putting a word out there that means nothing. I've talked to my leadership in my city where they say we have affordable housing. And when I ask them, well, what's the number attached to affordable? They don't have a clue. They continue to put forth a, a rhetoric, a narrative that just is not true. It is time for us to adjust the way we think. It is time for us to really study again in 2024 what this thing called economic struggle and poverty is. People would be surprised to know that the poverty wage is calculated at the federal level, and it's the same. Whether you live in Mississippi, where we know the cost of living is lower, or if you're in New York City, where we know the cost is higher, the number is exactly the same. It's time to modernize our approach to this subject. It is not enough to let the federal legislators continue to dictate that without input from the local jurisdictions. That way, we can really craft what affordable is for an area because we'll have an accurate number. All of these programs are based on a federal minimum wage, a federal poverty guideline, and that has to look different depending on what part of the country you live in. That's a basic, and we refuse to do it any differently. It just continues to sit at the same place, and the outcomes are going to remain the same. And quite honestly, we can't afford not to. I have a child, I have three grandchildren whose outcomes are going to be dictated based on where I was when they were born. And unfortunately, it's outpacing all of our spending and all of our efforts. We're spending more and more money, but we're not changing the way that money is allocated or spent. We can literally make sure that people are making a living wage. They pay more in taxes. They will pay more towards supporting the community. That's what we want. It's going to take a multi-generational approach, but that's what we need.
That actually leads perfectly into my next question because I think that there is a historical discrimination in pay that shapes patterns of poverty. How do you think those patterns of discrimination in pay has shaped poverty in Maryland?
I do, my company does learning around policies, systems, and structures that impact economic inequity. And one of those learning opportunities assigns a race to the participants. We go through policy, and at the end of the simulation, based on your skin color, you'll have so much land, money, and lost opportunity. And I think that illustrates perfectly the onus of systems and structures on this fight against economic inequity. It is important to know that very legal segregation, very legal discrimination, practices of making people show up to work and be owned by their employer has impacted what we know today as the fight against economic struggle and poverty. We know that based on your race, gender, identity, you make less money. Those are practices that stem from discriminatory and racist practices. That continues to affect us today. There are studies, again, on all of this, but most of this is rooted in discrimination. Most of this is rooted in sexism, racism, ableism, ageism. Those continue to exist today, but there really were policies that we can start with that were legal that oppressed people. And while we say that we have laws, we know that the law is only as good as it's enforced. And these cases are hard to prove. No one, well, I shouldn't say no one. Most people are doing things that are so slight, you can't quite say what's happening, but you know why you've been passed up for that raise or for that promotion. You know why you can't get ahead, but it's hard to prove.
You talk about the policies, and are the I know that it's difficult. There is continued discrimination in the blind and low vision community. I myself am not blind or low vision, so I will not speak for the community.
Right.
Um, but I have heard the stories of my friends. It makes me shake my head. Something occurs to me that's
Mhm.
kind of outside pay, but kind of goes back to something you said earlier. It's tangentially related to education, but healthcare. Healthcare access and outcomes differ for communities affected by poverty in Maryland. And what do you think the long term impacts are for those who live in poverty when it comes to healthcare? Their access to healthcare. What is that like? And
That's a
I
tough
didn't mean I
because
didn't mean to hit a.
no. When you said it, I began to think of a couple of different things. First of all, if you're a low wage worker, what sick time, what vacation time, what insurance? What are you talking about? That doesn't exist. Like co-pays, if you got coverage, right? I just began to think of so many different factors in the healthcare thing. Again, we think about healthcare being there, but who actually has access? And if they don't, then why don't they have access? Most of the people that I know just can't afford to be off to go to the doctor. It's as simple as that a lot of times. However, let's just say that they do have sick time they can take. Um, Over the years, and I go back to history, the folks from my community really didn't go to the doctor. We didn't trust doctors because of so many things. The Tuskegee experiment, right? Um, the faith community in my community believe that you pray. Um, there are so many factors that affect healthcare, but I would say one thing that I would identify is understanding what it means to take care of oneself. We grew up as descendants of enslaved people. There was no medical care. So at what point did a switch go off and we were supposed to understand how to navigate the healthcare systems? Um, I have friends who have died way too young because they did not care for themselves. And it isn't that they didn't want to. I think that they didn't understand what that care looked like. And I don't think that we understand completely that just having healthcare there doesn't mean there's a quality of healthcare. As we talk about urban versus rural, there are much less providers of specialty services in rural communities. And the communities that are affected by the most poverty probably don't have any practitioners at all. So when we talk about healthcare, I think of so many different things: access to sick time, access to affordable care, access to understanding and knowledge. I've seen people come to the doctor with bags of medication that they're not taking. They need almost a specialized service to understand what they're taking and why. As a result, the health outcomes, the life expectancies of people who are experiencing poverty is reduced by so many different factors that we have to consider.
I was just about to ask you that. So I just want to recap what you're saying because I think it's so important.
I'm saying a
It's
lot, so I
You
get
were
it.
saying a lot, and I want to recap it because you said a couple of things, and I think it's so important to recap it. Systemic generational poverty prohibited access to healthcare systems where knowledge of what you're taking, and how to get access was prohibited.
That's right.
And as a result, healthcare outcomes for generational poverty survivors is lower.
And one thing I didn't touch on is when you don't have money, What do you eat?
Junk food.
The cheapest food, whatever they got. Those foods inherently lead to a lot of the conditions that we deal with. So there are so many things that I could touch on. Again, I don't think people understand what this thing called poverty really does. They understand what it maybe is. You can't pay your rent, and we're going to give you this. But the implications of poverty lead to so many different things, to include wealth, life expectancy, health, um, that we just don't ever touch on when we evaluate poverty. We just give them stuff. That's not enough.
Listeners to my podcast know that I send the questions ahead of time. I want to skip one of the questions and come back to it because I want to touch on another health question, which is the COVID-19 pandemic. Because it kind of goes hand in hand with what you just said. The COVID-19 pandemic really impacted people who are survivors and who are currently stuck in systemic poverty cycles. And especially here in Maryland. In terms of job loss and economic recovery, what are you seeing?
We know that there were gaps before COVID-19, or let me say it differently. We are seeing something emerge for well resourced, middle class, and wealthier folks. So it should be expected that people who were already in struggle are going to be affected in ways that are even greater. There were already gaps, there were already huge gaps in outcomes. Being that the middle class is being affected, it's a fair assumption that people who are experiencing poverty are affected at even greater levels. And I'm going to go back to the work sector. Um, we know what those low wage jobs are, and we know who works in those low wage jobs. We know how many restaurants closed. We know how many service industry jobs were lost because of those closures. So it is inevitable that the people most affected by those closures are people who were experiencing economic inequity. They are
Mm.
just not resourced well. The savings are non-existent, and there are only so many jobs. So I think that it's a given that with the closures we've seen, we know who sits in those jobs, and we know how they were affected.
COVID-19 really impacted a lot of things globally. So I wanted to kind of merge that with the healthcare. What are some key challenges for social services and public assistance programs in addressing poverty in Maryland? Because it's easy to look at the numbers and say that they gave out, hundreds of thousands of dollars in aid. But when they're with the boots on the ground, the ones who are on the front lines, like yourself, what are the actual challenges? Because those dollars only amount to so much in actual facilitated aid. Like you said earlier, it's great to give stuff, but what about the systems?
So I think that what you're really asking, or what you're asking, is the impact of the money we spend. That's not something that's really been evaluated or
Really?
studied. No. We give the money, and like you said, we're done. But does that mean we really got to the root of the problem? We are not getting a return on investment that matches our investment of money into programs. The nonprofit model, the service model, is flawed. We do need to immediately address when someone's hungry. But are they hungry because they don't have money in their budget for food, or are they cost burdened by rent? Do they need an affordable housing option? Or do they need affordable childcare? What's really happening? And we don't ever take the time to really drill down. And to be honest with you, staff and our governments really see poor people as less than, and they treat them as such. Recently heard some very disturbing comments in a city's community meeting about poor people. And when they look at how much they spend on certain things, there's a judgment there. And a friend of mine made a great comment that, well, whether you're well resourced or not, there are a lot of people who don't know how to budget money well. Why are you picking on poor people? And one of the learnings that I do helps people to really understand the decisions that families have to face every day. When you wonder why a person would purchase a large TV, well, if you have a certain amount of kids and you have to work every day, that may be the only babysitter you can afford. There are
Mm.
so many different ways we have to look at this. We live in a place that is quite classist, and really look at the downtrodden as people who should be grateful for whatever we give them. I had a family in need reach out to me recently to say that they went to a local nonprofit where they were giving away food and they threw the food at them like they were dogs. There's a service quality that's missing. I don't believe you should police food distribution. If people are hungry, have it available 24 hours a day. It can be done. It can literally be done. We can eliminate staff, CEOs of nonprofits. We can eliminate jobs that are literally built on a complex of we help poor people. No, you really actually aren't. But if we took that funding and had, I don't know, food vending machines where you come and press a button and the food just comes out. Why can't that be available all the time? Why do I have to put in an application because I say I'm hungry? Why am I expected to go to work, attend to my children, pay my bills, and do everything and go try to find food at the end of the day? When all you got to do is press a button, maybe, and the food just comes out.
So you're
I'm
saying there are barriers to access in both a physical format of having to do applications and apply for services, as well as service barriers where people are being seen as less than.
Absolutely. So there's an access barrier, right? There, what you're talking about is an administrative burden. Um, an example of it is when you need rent assistance in my city, you have to apply with the city and the county and navigate with both. Why can't they navigate with each other? Why do I have to be at the middle? You're the ones that need to coordinate it. Why do I have to be in the middle? If I give my information to one person, the second person can get the same information from the first provider. Why can't we do that? Why do I have to come in for an interview when everybody has meetings via Zoom? Everybody uses Google Forms, but I have to go in to get help, especially when I've been evicted. So I need someone to watch my stuff. There are so many things that we could do to advance the model. There are so many things we can do that would allocate more money to the resource and not allocate more money to the salaries. There's a different model that can be put forward, but people are unwilling to really think about how that could look versus the way it looks now. They are comfortable um, serving people in the way that they deem appropriate.
That's a really unique perspective, and it's not one I've heard before. And that actually brings me into my next question, which is all about policy change. And this would honestly be my last question because it's not a doozy of a question, but it's one that
Mhm.
I know that you and I have talked we talked about when you sat in your car on that very windy day, and I was really struck by your answer. So I know that your answer is like gold. But what policy changes would make the most significant impact in reducing systemic and generational poverty here in Maryland?
Oh boy, I
I
think
told
that
you it was you answered it beautifully.
now I don't even remember what I said, but I will say this: before we do anything, we need to understand that the solutions as a well-resourced person or a person who did not struggle as an adult to make the decisions families have to make are probably not the best people to make the policy.
Okay.
We really do need to understand what we don't understand about economic insecurity and poverty first. That's going to take learning, it's going to take training, it's going to take bridging. And it seems that the people who are in charge think they know it all, and they don't. They continue to put forward misguided policies and practices that simply are not working. And if I can get them to acknowledge that first, I think we can get a long way in this thing. We're spending the money, but we're spending it in a way that is not plugging the hole of struggle. It's possible. It's possible to really look at how we do things and evaluate the outcomes to say this isn't working, at least in the long term. I think it starts with those in power saying, we don't have a frame of reference. We think we know what people need, but we actually don't. We have the money, we have the stuff. Let's really drill down. Let's really drill down on what people need. And the people that know that are the people that are closest to the problem. It does take someone to navigate both worlds. And in my role as a cultural broker, that is one of my skill sets. I'm able to hear what's not being said by both groups. And I attempt very hard to utilize that by serving a person in need, but then taking it back to the decision makers to say, this is where the gap in service lies. They tend to not always be receptive, but I could do it
Uh,
because I know that's what's needed. Again, it's not as simple as you need a box of food. We need to figure out what happened to get you here and then beginning to shift our service model.
so I just want to, again, soft hammer what you said because it was so important. The people who are the ones who are in generational and systemic poverty need to be brought to the table and to be part of the conversation. We need to bring people of all backgrounds, regardless of race, age, ability, gender identity, to the table to have these conversations. And because they're the ones who know what they need and where the problems lie in going from systemic generational poverty to moving out of those systems.
Agreed. And it's not enough to have people at the table. Equity means that they have power.
Oh, I like that.
So that means that the power shift has to occur from the people who are the legislators, the people that are at the top. The power dynamic needs to shift. You have the power to create the legislation, but you may not have the right model to tackle a conversation. You really do need a middle person there and to understand that the power really lies in the community, not at the top. And that's one thing that we don't do enough of is shifting the power model.
So we need you and other cultural brokers.
Agreed. That's it. That's it. Because those two groups really don't communicate well. There is a distrust. I find that legislators sometimes are very intellectual, and the people that we say we want to serve sometimes don't navigate in that world as much as we think they should. And there's a miscommunication that often happens, especially when sometimes they're reluctant to really express what they're struggling with. So that's why the cultural broker is important because they can hear what's not really being said because of their
Mhm.
own experience. And they can sometimes craft it in a language that legislators can process and vice versa.
Now, with your consulting, the rose petals consulting, and your expertise, um, could you give an example of a time that you acted as a cultural broker between someone who had a need and someone who wanted to provide a service but didn't understand the need?
I have a million stories, but one I'll focus on is in my own city. We had several families displaced as a result of an explosion in a community that that's within the city. It's called Potomac Oaks, and the county was responsible for giving the aid. They gave everyone the same amount of money. They gave everyone the same access to certain services. But what they didn't know is if a family was already in economic struggle, they gave something that was called equality. That wasn't equity. They never sat with families to understand where they were and what they needed. I worked with a gentleman whose insurance company refused to pay him. We have regulations at the state level. So someone at the county level should have been in communication with someone at the state. And he was left to fend for himself, navigate for his baby and his wife. And no one ever sat down to assess what was really needed. I became aware of it when 2 weeks after the explosion, the county was putting everyone out of the hotel they were paying for. There was no place that could house people at the rent that they could afford that was vetted for these people. They were just put on the street. That's not equity work. So I had to come in with a hammer, not a mallet, actually, and really begin to sound the alarm. And I had to sit with my legislators and decision makers for them to understand how the equality model did not work for people who were already marginalized. Can you imagine that if someone were disabled? Can you imagine that for a person with school age children who's just trying to work every day? Well, I got to see it firsthand. And they thought they did a good job because they gave everybody a couple $1,000s. One of my neediest families, her car key was 1,000 of that. There was an opportunity to serve well. There was an opportunity to be equitable, but they decided that they would utilize the model they always had. And for me, that was an opportunity to say, you know what, we didn't quite do that the way we should have. Let's see what we can do to change that model moving forward. It hasn't happened. I had to literally fight the system to do what the system says it does. And we got it done, but it was at a great expense. And there were a lot of articles written about it because I got so vocal. There was some recorded testimony. My city called me in to speak to me about how I was advocating for these families. But the truth of the matter is no one else was doing it. But when things like that happen, it's an opportunity to say, we made a mistake, let's evaluate it. Never happens. Those are the types of things we need to look for, and I do it constantly. When I'm riding around in my car, if I see someone being evicted, I stop my car. Um, it's been twice that I've done that, and I found out that the rental assistance that was promised never came.
Mm.
And now you're evicted. The check was literally for one person sitting on someone's desk, and this person called every single day to check on it. Where there's smoke, there's fire. That was not a one-off. It's happened quite regularly, actually. Those are opportunities to both serve, but to evaluate our programs, and we almost never do it.
How does one become a cultural broker like yourself?
I'm asked that a lot. I've always been a person who inserts myself in certain spaces, even when it's not comfortable. Um, and I think that it's just experience I gleaned being that person. But I would say anyone who's experienced a certain thing, whether it be a person who is a certain race, a person with a certain ability or a certain age, I believe there's potential for all of us to be that. If you have the drive to want to see a change and the resources to begin to navigate that change, and the most important resource is time, it doesn't require a certain writing ability. It doesn't require a certain way of speaking. It does require you to make the commitment to say, I want to be heard in these spaces, not just for myself, but for the people I know that are affected by this. Begin to insert yourself in spaces like your city council meetings, your county council meetings. One thing I do that I found out is not quite normal. When I move into a city, I immediately request a meeting with my legislative leaders because I know the work I do, they're going to hear from me. So they better get to know me very early on. But begin to ask for those meetings. Begin to join in spaces and just begin to learn. I literally began to understand the legislative process when I advocated for a law in Florida after the death of my aunt. And that's how I learned about the legislative process. I didn't go to school. I just said, we need a law. And I began to lobby and interface with different groups. And that is literally why I'm here today. I just inserted myself in places. And I want people to know that even if you're a person who is experiencing economic struggle, even if you receive public benefits, if you grocery shop in the community, if you buy gas, you're supporting your community's economy. You have the right to be heard, no matter what anyone tells you. I don't care if you receive SNAP benefits, SSI, Social Security, disability. If you shop in your community, if your children go to the schools, your children's bodies provide funding to the school district, you have the right to be heard. So don't ever think that because you're not a person who has a high income or a person that doesn't have a title, you don't deserve to be heard. If you support your community's economy, you have the right to be listened to.
And that is a great place for me to pause and end this podcast because I think we all want to be heard, um,
Absolutely.
especially when it comes to uh, this topic of generational and systemic poverty and where it falls here in Maryland because it's a dichotomy.
We got a lot of work to do, but we have the resources to do it, particularly with a governor who says that he wants to end childhood poverty.
Exactly,
A great place
exactly.
to start. We got the stuff. Unlike a lot of places, we have the stuff. We just need to begin to examine how we're using it.
I don't disagree. Just hang on the line for me 1 minute, and I'm gonna wrap up. Ladies and gentlemen, thank you so much for being here with me today, and for Miss Tiffany for being with us today. I am a little in tears because it was such a passionate program for me today. And thank you, and I'll see you again in February.
Thank you for having me.
This has been a presentation of the Maryland State Library Agency. For links to additional resources provided by today's presenter, please visit the show notes. For more information on MSLA or the Maryland State Library for the Blind and Print Disabled, visit marylandlibraries.org.